There are several questions that have been coming up about COVID-19, and I'd like to go through a few of them. What is the most important thing for you to remember about COVID-19? Well, cover your cough, wash your hands, and if you're sick, stay home. It really hasn't changed. Another question that comes up is, what do we really know about COVID-19? And the answer is, we actually know a fair amount. A dozen years ago, I participated in a tabletop exercise involving an imaginary viral disease that started in China and caused a pandemic. So a lot of us learned a lot 12 years ago about what to do right now in 2020. On top of that, COVID-19 has been in the US for a few months, and the medical literature is accumulating some experience. So we can rely on what actually works when we're facing COVID-19. One of the things that people ask about a lot is, how does it spread? And I have to take a step back and explain a few things, because the question of how COVID-19, which is caused by a virus called SARS-CoV-2, the question of how COVID-19 is spreading depends on some medical terminology that can sometimes be a little bit confusing. The reason is that we use the term droplet spread. And by droplet, we mean what happens if you're standing really close to someone and they sneeze on you, or they cough on you, or they're just talking enthusiastically and a little bit of spit lands on your face. You feel those droplets, and when one of those gets to you and gets in your eyes, your nose, your mouth, that's how it spreads. The reason it's confusing is that we breathe air, and the droplets obviously go through the air. But when doctors use the term airborne transmission, we're talking about something very different. We're talking about particles that contaminate the air and can just float there and stay there for an hour or even longer. You're talking about situations where a little child who picked up measles in Disneyland walks into a waiting room for a doctor's office, coughs a little bit, contaminates the air with the measles virus, leaves, an hour passes, somebody comes in, and even though an hour has gone by, they can still get measles. Droplet spread like COVID-19 doesn't work that way. You pretty much have to be right there for them to spit in your face or cough in your face or sneeze in your face for you to get it. And the pattern of disease is very, very different. As you can imagine, with diseases that are true airborne, like measles, given person will tend to infect 10, 15 others. If you live in the same household with somebody with measles and you haven't had it yet, or you haven't had the vaccine, you have an 80, 90% chance of getting it. Very different for droplet diseases like COVID-19. There, you're talking about, maybe 2, 3 people who might pick it up from somebody who's infected. And you're talking about, even within a household, only about a 10% chance that somebody's going to get it. And that's true, even though the major way that COVID-19 spreads is in households. And this all leads to our approach to cutting down on the spread. And like I said, cover your cough. So if you happen to have it, you won't be able to spread it to somebody because you've covered your cough. Or wash your hands. If somehow you've touched something that might have picked up a little virus, even though it's unlikely you pick up enough virus to actually infect yourself. But if you wash your hands, you'll clean off that virus. And if you're sick, stay home. That way, you won't run the risk of spreading it to your coworkers. So it turns out that we have all sorts of ways to cut down on the spread. That's why the CDC recommends that when we're out in public, we wear at least a cloth mask. And when we're in the VA here taking care of patients, when we're having face-to-face contact with patients, we wear at least a surgical mask. And in very special situations, most of us do not do this. In special situations where we're generating aerosols, then we'd wear something like a PAPR or an N95 mask, but most of us just don't do that. And another question comes up, which is, what if somebody's been exposed to somebody with COVID-19? What's going to happen? Well, there's actually a lot of experience with this, and the CDC studied the first 10 patients who came back to the US with COVID-19, and they found that the chance that any of their contacts got it from exposure was only about 0.5%. They also looked at a patient in a hospital in California who was one of the first people in the US to have COVID-19, and they didn't suspect that the patient had it. And they looked at dozens and dozens of people who worked in the hospital to see if they got it, even though they weren't taking any special precautions at all. There were only 3 cases out of the dozens and dozens and dozens of people who got it, and 2 of them were doing aerosol generating procedures where we do all sorts of special things to protect ourselves, and another person had a lot of contact with the patient. So one thing I can tell you, if you're exposed in a healthcare situation, is there's not much chance you're going to get it. What we would want you to do is, you could consider getting tested. The average time from when you would get exposed to when you get sick is about 4 to 5 days. The maximum time is pretty much 14 days. Now, if somebody actually does have COVID-19, they actually have a test that shows they have it, then we would want you to be in touch with occupational health. And some of our guidelines are changing, but in general, you would have to be out if you actually have COVID-19 for at least 10 days, in certain situations, 14 days. And you'd have to have any respiratory symptoms improving if you really did have respiratory symptoms. And before you go back to work, you'd have to have 3 days without any fever and taking acetaminophen or Tylenol. That's cheating. You have to be no fever without taking any drug that cuts down on your temperature. Now, another question that comes up is what to do if you think you have COVID-19. What you should do is call your healthcare provider, and we'd want you to call first rather than just popping into an office, because they may need to take special precautions so you don't spread it to anybody. The warning sign with COVID-19 when you need to get care right away is shortness of breath. Shortness of breath, that's the real warning sign. What about treatment? Well, it turns out there's really no treatment that is definitely established to work for COVID-19. So if somebody comes to the hospital, they need oxygen, we give them oxygen. We do so-called supportive care. There are a couple treatments that are very promising that are being evaluated. Remdesivir is a drug that has gotten emergency use authorization, although it hasn't met full FDA criteria for being regarded as safe and effective, and it's available only in a very limited supply. There's also a study being run by the Mayo Clinic to take blood from somebody who's recovered from COVID-19 and presumably has antibodies to it, to take the plasma portion of that blood that has the antibodies and drip that into somebody who's real sick with COVID-19 to try to affect the course of their illness. So we have some things that we are looking at that are promising, but not yet at the stage where they've met all standards of proof. So again, I'd like to ask a question I've asked and answered before, and I want to ask it again because it's really the most important thing for you to know, and that is, well, really, what's the most important thing for you to know about COVID? And the most important thing for you to know about COVID-19 is cover your cough, wash your hands, and if you're sick, stay home.